Hi everyone, good evening. Am I audible and visible? Please confirm so we can start with the session. Just waiting for more people to join in and live chat to start. So I have the YouTube open in front of me. So I'll be not showing any PPT here. It's more of a discussion session I'm going to have, not academic. Obviously related to academics, but still not academic. And I'll be taking whatever doubts you people have. So good evening, Shashank. All those who are joining in, and just wait for 1 minute and then I'll start with the session. I hope your SS exam went well. This is our first live session that we are having, meeting after the actual NEET SS exam got over. I put up one analysis video, but that was a recorded session. This is the first live session we're having. So, good evening, Surendra. I hope everyone is fine. All those who are joining this video, please like the video, subscribe to the channel, the usual things, which I have to say, right? So, good evening, Richam. Good evening, Dr. Bhushan. Good evening, Sharanu. So let us start. Let us begin with the session. I think more people will keep joining in. So your NEET SS exam was done. I've already talked about it that it was a difficult paper when it comes to pediatric part. I did receive some inputs related to medicine and surgery part as well, but obviously that is not my domain, so I will not comment upon that. The pediatric part was definitely difficult, and there were a lot of you who made a lot of silly mistakes also, as I've been told. Silly mistakes you cannot make in a paper which is difficult. In an easy paper also you can't make, but in a difficult paper where some questions are kind of unsolvable, it becomes very difficult for you to come back if you make those silly mistakes in easy topics, right? So what next? This session we are going to talk about what next. Your NEET SS exam is done. See, the result will be expected in a few days. Uh, right now, what is your status? Now, if you belong to the first category, scenario one, that your exam went very well. When I say very well, I would imagine that you must have seen or you must have roughly calculated your scores. And if you're expecting a score somewhere around 420 to 450 out of 600 or more than that, then I would say in this pediatrics SS score, this is a very good score. And there is a very high likelihood that you will get something good in your exam. See, there will always be a topper, there will always be a ranker who will get a very high score, somewhere in the range of 500 out of 600 or even more than that. But majority of the top rankers, it is expected. See, I can go wrong also. It is just conjectures which we are making. But there is a possibility that anybody between a score of 450 to 500 would be very reasonably comfortably placed in a tough exam like that, right? So if you are belong to that category and you are confident enough, you can read leisurely, you can take a break, but end of the day, it is very difficult to predict your exact rank. Suppose you want a seat in a metro city in a branch like neonatology in one of the topmost institutes, then even if your exam is very well according to your standards, you cannot be sure because one question here or there can really bring down your rank. If you belong to the second category, that your exam went well, but you now think that you should give another shot at INISS, you need to start preparing honestly for that exam. Third category, you're not sure how your exam went. You made some mistakes, but are not quite sure. In that scenario, also, or if your exam was not up to the standard and you made a lot of mistakes and you feel that you may not get a seat of your choice this year, then also you need to start preparing. In all circumstances, you should start preparing for INISS exam. Now, when I say you should start preparing for INISS exam, good evening, Osama. So when I say you should start preparing for INISS, a lot of people start saying. Now it's a common human tendency to. I got messages related to that as well. Some people said, "Sir, NEET SS went bad. What do you think is going to happen in 2 months from now in INISS?" My answer to you is a lot can happen. End of the day, you are a pediatrician. A lot of people. One student also messaged me saying, "Sir, I am an average student. Should I sit for INISS?" If you are a pediatrician, you do not belong to the category of average student. There is no such thing as average student in general. That is a nomenclature I never support in any stream of medicine or any stream of branch. It is all in our mind. But even if you consider yourself average, if you are a pediatrician, you belong to the cream of the society. You have attained a certain level in your academics, in the society, in the medical field, and so there is no such thing as being average or below par. So you should throw this concept from your mind, first thing. Secondly, you should look at INISS with all sincerity. If you start preparing, if you start thinking that I will be sitting in the next NEET SS exam in 2023, you are going to waste a lot of time. So for now, your aim should be that INISS, I am going to prepare with the best possible resources, with the best possible energy I have, and let us see how much improvement I'm going to do. There have been students, if you look at past interviews, some of the INISS rankers, they have been pretty, average to above average students in their academics and during their residency. But when the time came, they found everything going their way, they worked hard, and eventually they were able to secure top ranks in INISS. So eventually you have to do your DM. That is why you are preparing. Why not target the topmost institute? Best case scenario, you will get through. Worst case scenario, the preparation you're going to do in the next 45 to 60 days, it is going to be extremely useful for the NEET SS 2023 exam whenever it is held. Having said that, the next question I'm assuming people are going to ask, already Sirasana has asked, when is the NEET INISS? See, the dates I am not exactly clear, but let us assume that since the session starts from January, so let us assume that the exam will be held in November. And if the exam is held in November, you have about 45 to 60 days, or you can, sorry, 50 to 60 days from now, which are available to you. So 60 days is a big day. It's a big time. So you should be preparing according to this time frame. So the next thing we are going to discuss is how you are going to plan your revision for INISS. First thing is take a date. It may not be actual date. Exam may occur slightly before or after that, but you need to have a date in your mind before you start preparing. So let us take a date, say 7th, 8th, 9th November, somewhere in the end of first week. Let us take that date, right? So you have about 55 to 60 days before that exam. So in the remaining next 55 to 60 days before INISS, you are supposed to do one complete reading and one quick revision. One complete reading should take about 45 days, 40 to 45 days, and one quick revision should take about 10 to 15 days. This is all that is possible to be done in this time frame which is available to you. You get more time, the exam gets delayed or something happens, you get bonus time. That is same for everyone. You can sneak in a small quick revision as well. So first is defining a time frame. Second is analyzing your performance. Look at your recent preparation, the recent exam you gave, NEET SS. How was your analyze yourself critically? Make a flow chart. Don't do it verbally. Don't do it in your mind. Sit calmly, take pen and pencil, write down all the systems, the major systems and the minor systems, miscellaneous topics, and start seeing yourself where did you go wrong? What were the areas, what were the topics where your exam preparation went haywire? You need to identify that. Only then you can start working on that. You need to see whether your resources were enough or not, whether you read Nelson properly or not, what was your accuracy standard in Nelson, did you make silly mistakes in the paper, did you have enough MCQ practice? There will be problems in either content or in accuracy or MCQ practice. These are the three areas: content, MCQ practice, and accuracy. So, in case there is a problem in any of these areas, work on that. If there is a problem in all three, you need to work on all three of them. So, first is analyzing, first is defining a time frame, then analyzing your performance. Then you start working on your weaknesses and strengths. And it should be done according to INISS exam pattern. Now, you know that INI exam pattern is more of a specialty oriented exam, and so your whatever specialty you are targeting, slight more weightage needs to be given to that. In addition, INISS, if you look at past papers, aims super specialty pediatrics past papers. If you see, you will find that there are always relatively more questions compared to NEET SS from community pediatrics, from health programs, from vaccines, from new drugs and monoclonal antibodies, and from your biostatistics. So these are the areas which you will have to read in addition to whatever NEET SS preparation you have done, slightly more in depth you will have to do. In addition, all the recent updates, the new drugs which have been introduced, the new therapies which have been approved in the last 2.5 years, you need to read them. And obviously, AIMS protocols will be very important. AIMS neonatal protocol also, AIMS PICU protocol also, and AIMS PICU protocol. Please do not try to read cover to cover. Selected topics based upon the older patterns, selected topics, and do them in a way which is easy for you to revise as well. Next thing will be making a schedule and do not read randomly because you are supposed to do one complete reading in 40 to 50 days. Do not read randomly and multiple resources. A common mistake most people do is they start thinking, okay, I have 50 days, let me read five different textbooks at one go. No, let Nelson be your Facebook. Add AIMS NICU protocol and PICU protocol, add PALS protocol to that, and whatever specialty you are targeting, one standard textbook, retrospectively high yielding from that area. Other than that, you don't have the time and you don't need to do it. Other than that, focus the whatever time you save, focus on MCQ revision of MCQ practice of those particular topics. And lastly, practicing MCQs. I agree that very limited resources for practicing MCQs are there. As for the PrepLadder Super Speciality Q Bank, the team is actively working on Q Bank. I have been told the entire Q Bank is likely to be revamped in a few days. Obviously, it will take a few weeks for the entire changes to be visible to you. So you should not wait till that time. And whatever resources you have, you start working on those resources. Regarding the NEET SS recall, I will be working on it. I am actually working on it. And very shortly, I will be posting the recall video also on the YouTube channel. So that will be available easily and all of you can see and, uh, add the relevant points and prepare your preparation accordingly. Regarding the request which a lot of students made, I'm quite happy to share that we are working and at PrepLadder, we are working on a lot of things right now. It will be premature for me to announce it before official information is out, but I'm currently working and the management has agreed to bring out some quick revision videos for you so that you are able to revise the say entire pediatric nephrology in about 3 to 4 hours, something like that we are working upon. And whatever topics on which detailed videos are not there but questions are still asked from them, like cystinosis, there are questions asked from that, right? But it is not a part of the usual lengthy videos we have covered on the app. So IgA nephropathy, for example. So important points from them from MCQ oriented manner. What I'm doing right now is recording those videos and adding those points to that. In addition, yes, as requested by you, the neurology videos, the pediatric neurology videos and pediatric nephrology videos are being re-recorded, and I am the one who's doing that. So whatever deficiencies suggestions have come from your end, we are incorporating that. I hope it will be beneficial for you. Once the videos go into post production, I will be in a better position to give you information related to that. So these were the things I had to discuss with you. Good evening, Gisela. Good evening, Raghavendra. Uh, so the way forward, let me summarize for those who have joined late. If your exam has gone top notch, you can afford to take some risk. Or when I say take a risk, read leisurely or do not read at all. For the vast majority, if you are unsure about your result or you have dreams of getting into PGI, AIMS, JIPMER or similar institutes, or if you feel your exam has not been up to the mark, you need to start preparing right now. And when you prepare, you should be targeting only INISS exam. NEET SS 2023, jab hoga tab hoga. Do not even think about it. Right now, your immediate enemy is INISS. Target that exam. When you target that exam, define a date. The date is still not out, but say about 50 to 60 days are there. So 45 days, you should do one reading, complete reading, systems. You will obviously the specialty you are targeting, you will devote more time to that. And other parts of general pediatrics also you need to do. Community pediatrics, vaccines, and biostats will be more important compared to NEET SS in this exam. Having said that, again, it is always a balanced paper. Uh, 15 to 20 days you should plan. Last 15 to 20 days before the exam, one revision should be done. MCQ practice is important. Do not read multiple sources and work with a positive outlook. About 4 to 6 hours of daily practice, daily reading is more than enough if you do it consistently. Not a single day should go waste. That's all needs to be done. In addition, those who joined late, I've talked about uh, the changes we are working on at PrepLadder, and I've told before also that a lot of things are currently in pipeline. Normally, what happens is we announce something and then it gets delayed. This time onwards, I've made sure once the thing is ready, then only we will announce, so that when we announce immediately the next day, it is available to you. So we're working on revision videos. We are working on topics which have not been covered. We are working on neurology videos, which based upon the new exam pattern, the way questions were asked. We are working on that already actively. I'm sitting in the studio right now. As you can see, this black thing is not there. It's a green screen, and I have come here to the studio only for recording purpose only. So all this is going on. I'll be announcing it shortly. The team will be announcing it shortly officially. So, Riba, when will HIV video appear? HIV part one, I've already recorded the part one. Part two related to the management guidelines, which includes the NECO 2021 update, as well as the WHO guidelines 2021-2022. Summarized form of that I will be putting. Summary will go on YouTube, whereas the detailed video will come up on the app, right? Uh, Ajmal, good evening. Where can we previous year INSS question papers? Ajmal, there are not any major recalls. Most of the questions which are there, they are based upon what we have, our own personal collection. So the videos which I have recorded, I have tried to give you small amount of detail, some small amount of suggestions of that this question has been asked in INSS and this question has been asked, but exact complete papers are not available. So let us see if something we can work on something like that. If we take new subscription, will we get hard copy notes? Shanta Pratima, see technical things. What are the packages? What is the cost of package, and what whether notes will be given to you or it will not be given to you, and which part will have notes with it. Technical things I do not have information right now in a live session, but you can contact the team and you can ask me separately on my Telegram group. Also, you can post, and I will ask the team and give you official information. That information right now, I don't have the exact information. Other than that, I hope everyone is doing fine, right? After an exam, it takes about 5, 6 days for you to come out of that trauma of having prepared and then the exam happening, and finding that some things went wrong, even if you had read it well. So that entire thing takes about 5 to 6 days. That time is now over. I hope all of you have recovered from that, and now it is time for you to get serious and target the next exam, that is INISS exam. Shant Pratima Nayak, my book is books take time to get published. So right now I myself do not have, I frankly do not have time for working on my book as well. But I have started working on it, but let's see when it comes down. The recall thing will go up on PrepLadder itself, right? You don't need to buy a separate book for that. The recall thing will go up on PrepLadder itself. Vibhav Gupta, I told before for NEET SS and INSS, this is no previous year question book. I am working on it, but it will take some time. It will take some time. So right now, for INISS, this is, let's not talk about my book. This session is about you people, not me, publicizing something which is not there. So let's talk about what is there. There are a few past NEET SS papers collection which is available without any explanation. Of course, you can go through them if you have not gone before. Other than that, you can follow the PrepLadder videos. In the upcoming sessions, I will be planning some academic sessions, which will include some INISS specific sessions also. This is something which we had not done last time, but we will be doing this time. If you remember previous INISS, I had posted some videos related to topics important for that. This time onwards, I will be taking up. There I had talked about list of topics. Here I will be talking about this time onwards. I will be talking about details of the topics. Academic sessions I will hold in the YouTube sessions in the subsequent days. But end of the day, it's a one topic that I'm going to take or two topics which I'm going to take. The entire preparation is going to be yours. You are going to focus upon Nelson with AIMS protocols with one standard book of whatever specialty you are targeting, along with the miscellaneous things which everybody does to almost same level. Don't try to make a khichdi or mixed vegetable out of that. Be clear, be specific. This is my base book. This is the second book. This is the third thing. No further reference books or review articles. Please stay away from random review articles at this stage. Not because they are not important, but because you don't have time for that. Rudresh, Saket Daukar, how much score we are in a safe situation, sir? Saket, it is like asking what is a safe score in 2020 match. Normally, we say that more than 200, if you score in a 2020 match, you are safe. But there have been instances where even 221 has been chased down. So there is no such thing as safe score. But just like 200 plus score in a 2020 cricket match is safe. Similarly, what I feel is if you're getting 450 out of 600, you are safe. When I say safe, if you want, okay, I want a rank one, what will be the rank one? Nobody knows. Rudresh is asking, good evening, sir. Request the new format used in video of CKT with black background is not good. The one used before with white background is the best. Yes, Rudresh. Uh, I hope the team the technical team is listening to it. They will note down the feedback. They'll note down the feedback. I'll have a discussion on this very soon with the team. Whatever you people say, we'll go with that. We'll change the format, no problem. What is the scope of critical care medicine? Is it a good option post medicine? Yes, Saket. Critical care medicine is coming up in a big way. A lot of ICUs are opening up, a lot of tertiary care centers are opening up, and India is moving, although it is not a right way to say, but yes, we are doing fine on a lot of mortality indicators in primary care. And so, a big chunk of our country with the rapid urbanization, we are moving towards tertiary care centers, and no tertiary care center will be complete without emergency medicine, ICU support. So it is an institutional branch end of the day. But if you are targeting to stay in a bigger city, in a corporate hospital, or in an institution, yes, critical care medicine is going to be something very good for your career. Good evening, Jay Prakash. For INSS, which book to read for pediatric neurology? As I said, pediatric neurology, usually for for INISS, it is set by AIMS and the central institutes. So they have their own set of questions. Nelson is the base book. Any topic in neurology which is covered in either in PICU protocol or in AIMS neonatal protocol, the neurology topics, you need to read them thoroughly. And sometimes selected top things are also asked from Fenichel and Swyman. Fenichel and Swyman are retro books, not to be read cover to cover. Only selected topics need to be read from them. Once you start practicing, once you start reading, regarding pediatric neurology's resources, there is a video which I have already put. You can watch that video and ask me again. In the next session, you can ask me again. I have already posted a video on INISS pediatric neurology where to read. It is there on the YouTube videos link of PrepLadder. Rough idea when NEET SS 2023 will happen? No, Sage. Very difficult. You know the circumstances. Exam is announced, then it gets postponed, then a case happens, then the counseling gets delayed, and so on, and the cases keep on happening. I don't think even a well qualified, gifted astrologer also can make such a prediction. Gisla is asking, I hope I'm pronouncing your name fine. I'll simply say Dr. Bhargavi. Sir, what's the scope of getting DM endocrinology INSS with pediatrics as my feeder branch? It depends upon how aggressively you want, and it also depends upon how good you perform in the paper. There have been people who have got that, but again, I hope you know that cardiology, GI, and endocrinology are the three topmost branches. And so a lot of people prepare for these branches. So your preparation level needs to be top notch. Having said that, there are people from pediatrics branch which do get into adult branches as well. Sir, which book would be ideal for Anas Muhammad? If you have seen both the books, Fenichal is easier to read, but there are certain things which are asked from Swyman also. So it comes down to the topic, which topic you are targeting, and certain topics are important in Fenichal, certain topics are important in Swyman. There is a video I have posted on it. It must be there on the YouTube. You can try to Google search that. Or if you ask me again, I can share the link with you again. There is an MCQ book for SS. Please suggest, sir. Jayaprakash, I cannot take the name of a MCQ book because of my reasons. We are in a place where copyright things are there, and public some other branding thing, some other author's name I cannot take right now, but you can simply do a Google search on Amazon and you will find that there is a past paper book. They're not for There is a past paper book for NEET SS. It does not have explanation, but it has some recall papers of NEET SS 2018, 19, and I think 20 is also there. So you can have a look at that book. Uh, Thank you. You're welcome, Saket. You're welcome, Doctor. You're welcome, Bhargavi. You're welcome, Shanta. I hope I've answered most of your queries. So a lot of things are in the pipeline. And yes, point taken, Rudresh, black background. I already knew this will happen, but it's okay. The technical team is listening to this video, so I'll convey to them as well. Because I still remember, uh, I'd gone into PGI. Dr. Singhi used to be our HOD, and it was a mortality presentation. That was my first presentation I had to do. Not a very great thing to start your pediatric presentations in the morning round, and I made it a very fancy kind of a thing. And it was a black background with a lot of animations. And as soon as the was started, I got lambasted. I was supposed to show it to my senior resident before that, but my senior resident, I'll not take name at that time, was like, okay, ठीक है, जो मर्जी कर देना. So he was like that kind of a laid back person. So I got really lambasted at that time, and I was told that white background always works better. Like this is what I have been taught. Having said that, a lot of people also agree that sometimes change in the background is important. So we tried changing the background according to the technical team. But if you don't like that background, we can always change that. DNB versus DM. Please enlighten us with some positive negative points. DNB exit is the problem. DM entry is the problem. You will have to work hard in both of them. If you come out of it, you will be a specialist in both the scenarios. End of the day, in certain corporate hospitals, there is I would say slight edge to DM people. But if you are a good person from a good institute, you are DNB in that, you do equally well in the exam. So DM is usually taken up early compared to DNB. Having said that, there are certain DNBs in institutions like Gangaram which are better than DM in many peripheral institutes. So it comes down to how good you are, number one. Number two, it comes down to where you want to work. Uh, Please like the video and subscribe to the channel if you have not done before, so that you don't miss out on any last minute, discussion or live sessions that we plan in the future. I've answered most of your queries. So I think let's keep the session short. Next week, I'll be coming live again. And this time, we'll be having some more discussions and some more, hopefully, announcements to make. And I hope the you know that what needs to be done. All of you are smart people. You're all pediatricians, not kids. You know it well. I'm just repeating that because if somebody says the same thing what we are thinking, it is easy for us to, apply them. So all the best for your exam. I'll be back with the recall session soon. And about other things, the videos and all the inputs, they have already been received. There are discussions going on, and you will find that all of them are implemented at PrepLadder SS. So thank you very much. Thank you for your time. Thank you for connecting. INISS, roughly 50 to 60 days. If you get more time, that is a bonus time, but 50 to 60 days. Are you willing to work for it? Ask yourself and go for it. Thank you very much. Thank you. Karthi is asking which pediatric SS branch would be better in metro cities. Depends upon your which metro city you plan to sit in, and it also depends upon your interest. See, neonatology, just like cardiology in adult medicine, it is one of the topmost branches. But are you okay with neonatology? That is the first question. Secondly, neonatology, if you say you want to work in Delhi or Chennai or Mumbai or Hyderabad, uh, there is some degree of saturation which is there. When I say some degree of saturation, everything is saturated. Eventually, you have to make your own place. But say if you are a pediatric endocrinologist and you like pediatric endocrinology, it is relatively easier for you to start your practice in a metro city compared to a neonatologist. I'm not saying that this branch is better over that branch. End of the day, the most important thing is what you like. If the branch is what you like and you are good in that, trust me, the city does not matter. It's like a gestation period. After completing your DM, there is always a gestation period. After doing MD, there is a gestation period. After doing DM, there is a gestation period during which you will go from place to place. You will maybe not be satisfied at one place, and your earning may not be that good. But once you settle into a place and you like your branch and you're good in your branch, you will earn a lot. End of the day, it's not only about earning; it's also about liking your thing. Yes, Uma, videos on pediatric neuro preparation. I will put up one video is already there on YouTube. You can have a look at that. If needed, I'll put another video again. And Bhardwaj is saying, so what about recall session? I'll post it shortly. I'll post it shortly. Okay, thank you very much. Thank you for your time. So all the inputs have been taken. So let's see. Thank you. Thank you.